Nasogastric tube insertion and removal. Check PCP orders. Gather supplies and equipment. Perform hand hygiene and maintain standard precautions. Introduce self and provide for privacy.
Hello, Ms. Roberts. My name is Savannah and I'll be your nurse today. I'm just going to go shut your door and provide you with some privacy.
Identify the patient using 2 identifiers.
Could you state your name and your date of birth for me?
Have the patient state their name and date of birth as you verify the information with the armband. Check for allergies.
And do you have any allergies?
Explain the procedure to the patient.
So today I'm going to be inserting a nasogastric tube. It's going to be for providing some suction or for feeding purposes.
Don clean gloves and apply proper PPE. Raise the bed to working height and lower the side rails as appropriate and safe. Raise the head of the bed. Choose most intact nares with the greatest airflow. Avoid placement in nares that has undergone surgery or injury.
Have you ever had any surgeries or injuries to your nose?
Examine the skin and tissue integrity with a pen light, noting breaks in the skin or tissue. Verify patency of nares.
Can you blow through this nostril? And with this one. Good.
Remove gloves and perform hand hygiene. Prepare bedside setup. Prepare the setup on the appropriate side of the bed. Place a towel over the patient's chest. Ensure that the patient can reach tissues, an emesis basin, and a cup of water. Place NG tube lubricant, fixation device, and skin prep on the bedside table and open the NG tube package. Measure length of tube needed for patient. Mark tube using tape. Fold ends of tape for easy removal. Lubricate 4 inches of the tube tip with water-soluble lubricant. Ensure patient's neck is hyperextended.
Okay, tilt your head back for me.
Direct tube down and back. Have patient tilt chin forward when the tube reaches the nasopharynx,
Can you tilt your head forward?
and advance the tube while the patient is swallowing, providing water.
Okay, she's going to give you some water and you're going to swallow, and that's going to help the tube go down better.
Encourage the patient to mouth breathe.
Just breathe through your mouth.
Advance the tube as gently as possible, rotating the tube as needed, and stopping when the tape touches the nares. Stop if resistance is encountered, and attempt the other nares if necessary. Stop if the patient is gagging. Support the patient and offer water, and inspect the tube for coils. Secure the tube with a securement device or tape. Apply skin prep if needed. Clamp and secure NG tube to gown. Remove the tape used to measure the NG tube. Check initial tube placement with an X-ray and check gastric pH per facility policy. Dispose of supplies. Remove and dispose of gloves and perform hand hygiene. Educate the patient regarding the NG tube insertion and any follow-up care that is needed.
So we've put this NG tube down your nose and into your stomach for suctioning purposes. If at any time you feel any discomfort in your nose or in your stomach, or you feel nauseated, just let us know. And please do not pull on the tube, and be careful with any movement because we don't want to pull this out.
Return the bed to its lowest position, raise the side rails, and verify that the patient call light is within reach.
Here's your call light.
Reposition the patient for comfort and assess for additional needs.
Okay, if you need anything, just let us know.
Document procedure, including the date, time, assessment, procedure, and patient's response to procedure. Check PCP orders. Gather supplies and equipment. Perform hand hygiene and maintain standard precautions. Introduce self and provide for privacy.
Hello, Miss Roberts. My name is Savannah, and I'll be your nurse today. I'm just going to go shut that door and provide some privacy.
Identify the patient using 2 identifiers,
Okay, could you state your name and your date of birth?
having the patient state their name and date of birth as you verify information with the armband. Check for allergies.
Okay, and did you have any allergies?
Explain the procedure to the patient.
Today, I'm going to be taking out your NG tube.
Don clean gloves and apply proper PPE. Raise the bed to working height and lower side rails as appropriate and safe. Prepare bedside setup. Place a towel over the patient's chest and ensure that the patient can reach tissues, water, and an emesis basin. Disconnect tube from wall suction or feeding if connected, and prepare the tube for removal. Flush NG tube per facility policy. And disconnect or clamp the tube. Remove the tape or securement device. Instruct patient to take a deep breath and hold it.
Okay, take a deep breath for me and hold it.
Pinch the tube and pull the NG tube out with a quick fluid motion. Dispose of NG tube. Dispose of supplies. Remove and dispose of gloves. And wash hands. Apply clean gloves and provide mouth care. Offer the patient a drink if allowed.
Okay. Go ahead and take a drink, and I'll wipe your mouth. We'll brush your teeth right after this.
Clean the bridge of the patient's nose. Remove and dispose of gloves and wash hands. Return the bed to its lowest position, raise the top side rails, and verify that the call light is within reach for the patient.
Okay, here's your call light. Let us know if you need anything.
Reposition the patient for comfort and assess for any additional needs. Perform hand hygiene. Educate patient regarding the NG tube removal and any follow-up care that is needed.
So we just took that NG tube out. Let us know if you have any nausea or If you feel sick at all, just use your call light and let us know.
Document procedure, including the date, time, assessment, procedure, and patient's response to procedure.